conversation.
Totally. Totally.
Alrighty.
Just waiting for you to pop up here so I can share. There you are.
I was kind of proud of our my title of COVID Shuffle.
Yeah, I was just
Yeah.
afraid you were going to make me do the truffle shuffle.
The Facebook Live is not over yet.
I'm not doing the truffle shuffle.
Stay tuned for the Truffle Shuffle coming soon.
No. No.
Oh, hello, everybody. We are just waiting as people file in. Single file lines, everyone social distance. They're so cute with your little face circles. Alrighty.
Must see TV. Thanks, Scotty.
Right? Like, thanks, Scott. It's because there's like nothing interesting on TV these days.
Everything else is reruns.
This is the best you've got. I'm so sorry.
Yep.
All right. Hi, Mike Aldridge.
Hi, Dr. Norman.
Hey, Dr. Norman. Everyone
well, if
behave.
it ain't the Goonies.
Everyone behave. Secretary Norman's here. All right. Well, we are going to go ahead and get started. We've got a crew here. So, as usual, I am Jen Bacani-McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Wilson County Health Department Administrator.
All right. Soon we will learn those titles.
It's so long. I keep wanting to come up with something shorter.
Yeah.
Like,
We'll come up with stage names soon. Trust us. It'll be great. You're going to love it.
Yeah.
All right. So we are going to start off with statistics, if that sounds good.
All right. So still in Wilson County, we have had one case. They have recovered completely. We have had 221 negative tests in the county as of today. So that is fantastic. State-wise, I wrote down all the numbers. Now, remember, these numbers are from Monday because they're just updating them 3 days a week now. So on Monday, we had 9,218 positive COVID cases. That's cumulative. That's not active right now. 800 cumulative hospitalizations and 188 deaths to date. So I did a little bit of math.
Oh, you did?
Yeah, and I found out that
this is the brain power coming out.
our percent positives are at 13%, which is pretty like where they've been. 12-13 is pretty average. So that's staying pretty steady. So that's good.
Alrighty, and that's percent positives for
Kansas.
For Kansas.
No,
okay.
for
Oh,
one
no,
out
for
of 221. So it would be
think-
what, a 0.5% positive for?
Yeah, because I think they were saying we're like almost. Oh yeah. We're about 11, 12 for the state anyway. So yeah, so that's great. Your math is good. Congratulations.
I can divide.
No, and actually, speaking of math, we've talked a little bit about case fatality rates through all of this. We still are at that point where we are testing mostly symptomatic people. And we say mostly because I know throughout the state we are doing things like pre-op testing, meaning if you're going to have a procedure like a colonoscopy or a hernia surgery or something like that.
Or even an oral surgery.
Oh yeah, or even oral surgery. You're probably going to get tested. And so you probably won't be symptomatic, but well, hopefully you're not, or you shouldn't probably have the surgery. But you will get tested most likely, and that'll be just the same old swab. But we want to make sure that you are safe and that everybody that's taking care of you, like someone doing anesthesia, the surgeon, the nurses, everybody, we want to make sure everybody's safe. So that's where some of the asymptomatic testing comes from. We're also in some of these clusters we've talked about. We see some asymptomatic testing as well. So.
And
oh yes,
we've talked about testing before, and we've made jokes about swabbing your brain. Yes. And I want to share this. I'm going to share this because I can, and she's my mother.
Oh yes.
My mom had to go get a tooth, actually, I think, extracted today. So she had to have a COVID test. She did it right here in our parking lot of the hospital, and I asked her, I was like, take notes because I want to know how it feels so I can tell people. And she said, it didn't hurt. It was weird feeling, and it made her eyes water and almost made her sneeze. But she said it was weird feeling, not painful.
So our overarching advice and lesson learned is you could probably do a lot weirder things. and a lot more painful things in life. So this, should be easy-ish. So if you do feel like you should get tested, if you have symptoms, you're not sure, talk to your doctor, and then we can figure out what the right route is for you. And in Wilson County, we've talked about that we have on-site testing. I know working in the ER and seeing patients in the clinic, we are getting those results in as little as 45 minutes.
Awesome.
And then sometimes it takes a couple of hours if we have multiple tests running, so that's very exciting. And we also have here in Wilson County the antigen testing, which is kind of like a rapid flu test, a little less accurate as far as like you could get more false negatives. Sorry about that. But also, and just throwing this out here because this is a concern for people, that it is a less expensive test, still a good test. So we don't want cost to be a barrier for people in making sure that they get tested. Oh, the math thing. Sorry, I was doing a segue to math, and then I completely forgot. No, that's okay. I think we do this thing where we talk about other things. Squirrels. So case fatality rate in Kansas, we keep talking about that because we fully acknowledge that nobody in the world knows exactly like what the real case fatality rate is, how many deaths there are among the people who have tested positive, because we still aren't, like we said, testing everybody in the world to see how many asymptomatic carriers we have. Originally, we were seeing numbers, 4, 5, 6%. Your typical flu season is 0.1%. We are in Kansas, when we calculate it out, we're at about 2% for the case fatality rate. And so we acknowledge again that we don't know what these true numbers are, but we're getting a better idea as we start testing more. But still a high percentage as compared to flu seasons.
Yeah. Can we have the antibody test locally? Yes, technically we have the capability of doing those tests here, but also
this is called teamwork. So why antibody testing is such a hot topic is because we desperately want really good antibody testing ability, because that's going to let us be able to know when we can safely do things, when people are immune, when people have had the disease already. But what we are still figuring out is what antibodies mean as far as COVID-19. So, for example, some diseases that we get, some infections that we get exposed to, like the common cold, we usually will get, we'll produce some antibodies, and then we're probably immune to it, but then we might get sick with it later on. Some diseases like HIV, we never produce antibodies that make us immune to the disease. And then some things like the things that we get vaccinated for, measles, mumps, those kind of things, we produce antibodies and then we're hopefully immune for life. So we don't know how our own bodies react. And then the testing that we have, depending on how, like the region, how much COVID we have here, we are seeing false positives that are really, false positives that are really high. Like it might say, yeah, you've got the antibodies. But what does that mean? Does that mean that you're immune? We don't know. So the most dangerous part of that is you might be positive, it might be a false positive, but you think you're immune, and then you go around doing whatever, with a false sense of security, and then people can get really sick that way. So yes, we actually have the capabilities to do those tests when we know that the testing is as good as it can be for us to know what to tell you if your test is positive. Because I don't want to tell you, hey, you've got a positive test, but I can't tell you what that means. That's not good medicine, and we want to make sure that we are telling you the right thing when we get those test results back.
Would it mean you have had it? It would mean at this point that you have had a coronavirus infection, not COVID-19 necessarily, because these antibody tests that we have now, they're just not as reliable as we would like, and they are cross-reacting. So if you had a cold this last winter that was caused by a coronavirus, you could still test positive even if you've never even come in contact with COVID-19 or the SARS-CoV-2, that specific coronavirus.
Or even, the coronavirus family has been around forever, and so you could have been infected years ago or something, and we just don't know what that looks like as far as antibodies to COVID-19.
Yeah.
All right. Just to address, I know people are like, why aren't you social every time we do this, people talk about social distancing and wearing masks for Destiny and I. We are actually very tiny people and we are 6 feet apart. You just can't tell because it's not to scale on Facebook. Just kidding. We know Destiny and I are slowly becoming the same person. We dressed alike this weekend accidentally.
We did accidentally,
and
yeah.
it's
Wore the same
adorable
outfit.
until you're like, oh, it's not.
It's
We're
not.
grown women. So we consider ourselves the same cohort because we work together. We have throughout this entire thing. We take off our masks for this show. Because we don't want to be all muffly. But also we have no one around us. We have no traffic. You'll notice mostly no traffic. So we're doing our best so that we can keep everybody educated. So not meaning to tell you to social distance and wear masks. We will put masks right back on as soon as we leave here. And we had them on before we got here.
Yeah.
All right.
Cherie, does someone else have better tests? Not right now. And that's the bummer of it. We really are hoping they're making great strides, and the US is it DA? Yeah, USDA
Or FDA.
FDA.
Yes.
Sorry, FDA. They're sending more and more are getting through. Like they're testing the tests.
They're researching, and there are a ton of antibody tests that are being researched around the world, just as there are tons of vaccines that are being researched around the world. So hopefully one of these tests, because they have to do more and more tests to figure out what the actual accuracy of the test is. And so as we get more and more information, then we're going to know really what we're dealing with at that point.
Yeah. So there was a question about recovered cases. We know that we have one recovered case here in Wilson County. Statewide, they're not releasing that information to us. We do know that we have a 2% fatality rate, which means that we have a 98% recovery rate. So it takes, oh, is that Millie?
Oh, my daughter's on here. She's 9. No, just kidding. Hi, Millie.
Yeah, so we know that 98% of people will recover. So depending on the length of their illness, yeah, I would 98% of the total cases, which I don't have the number for.
And until we are able to, I mean, because everybody has to report, it's not as easy as saying like, oh, this test was positive or negative for recovery. You have to like go by the criteria and be able to determine if someone's recovered and then report that. It's not like a lab test that is faxed over. It's like you have to physically report.
Local health departments will monitor them, and then the local health department each has to put it into this tracking system that we call EpiTracks, and they put it in there, and then we know, and ours is in there, but not everyone is keeping up with that, so the number's not accurate, so the state's not giving it out.
All right, and you'll notice we're all about accurate information. We want to only give you good information. We don't want to give you anything that might not be right, and the state is the same way. And if Secretary Norman is still on here, we will give him a shout out because I think, this is a tough time for people and for decision makers, and there's nothing pretty about, everything that's happening right now. There's big decisions that have to be made. And the Secretary Norman stated the other day, last week, that the KDHE is not a partisan entity. So they've existed no matter if it's a Republican governor, a Democratic governor, no matter what. They exist, they have staff that just does health-related things. And so we appreciate that because we want what's best for Kansans, no matter what, with the evidence that we have and being able to make the best decisions.
Yeah.
So
there's is he someone you know?
Oh, yes. Oh, but you know what?
Did you have another one?
Yeah, so I think that was kind of a lead into a question about the announcement today from the governor. So we should talk about that, and then Tom, we'll get to your question in a second here. So do you want to start with that one?
Yeah, so the governor was on at 3 o'clock today and announced that she has vetoed the bill, that last bill that encompassed a whole bunch of different stuff, that the legislature put out at 8 a.m. on Friday? I think it was Friday.
They had a almost 24-hour legislative session. It was supposed to be one day on Thursday only, and it went from 8 a.m. Thursday till almost 8 a.m. Friday.
Yeah.
Craziness. That would suck, I think.
It would be horrible. Yes.
Okay,
But so they put out this big bill, and it had a whole bunch of stuff in it, and she's vetoed it, which we're not going to really talk about because, frankly, it's a 30-page bill, and I did not read every word of it. So it's vetoed, so it doesn't matter anyway. But what does matter is that since she vetoed that bill, then her emergency declaration will end, the one we are currently under, will end at midnight tonight. But she has issued a new one to begin midnight tonight and go for 15 days, which would be June 10th. Now, emergency declarations are important for
Many reasons.
many reasons, but one of the biggest reasons that emergency declarations are so important is for resources. We have issued an emergency declaration at the county level back in March. The state so we can get state resources. The state issued an emergency declaration so they can get federal resources. So right now, I know in Topeka, I think it's at Forbes Field, the National Guard is packaging food for food banks all through the state with the outreach program. I don't know if any outreach program people are on here or not, but they're doing that, so that would go away. There is the personal protective equipment, the PPE, that we are getting, that we can get from the state, that we can order through the state, that would go away. The testing capabilities would greatly be diminished. I mean, all of those resources that we're utilizing through these emergency declarations, that it would just cut off the supply. So that is really, really important. It has nothing to do with
any orders, really.
Any orders at all. It's simply stating we can get these resources.
Yeah, I think that's a great clarification, because oftentimes people will think like, okay, like someone's making a big deal because they're saying it's an emergency declaration. We're still in the middle of this pandemic. Just because things, are changing day by day, and we are seeing numbers drop, it doesn't mean that the virus is any less contagious. It doesn't mean that we are, in the clear by any means. So I think things like this, to make sure that communities like ours and around the state and really around the country are getting the resources that they need. And that, really, the byproduct of all of this, we know it's been a strain on the economy. We know people are out there that are hungry. We know that people just need resources and need help, and that's what all this is about.
Yeah. So some of the governor's executive orders are being brought forward with this new disaster declaration, and some are not. The ones that are mainly have to do with economic stability. The mass gathering order, which is what the stay-at-home. Ad Astra, thank you. The reopening plan, the Ad Astra plan, that's basically what it was founded on. It is not being brought forward, so it will expire at midnight tonight. So those decisions and those next steps are being put back to the county level, which we feel is good. There are a lot of different sized counties in Kansas and a lot of different things going on. So
we fully recognize that we've had one case that's recovered, and we're proud of that. We don't think that's by accident by any means. We know that people have been working hard to keep everything safe and stable here, and we know that we're not a county that has hundreds or even 1,000 cases like some of the other counties. And there was a question here about it goes back to the county. Is that the county commission, or is that me as a county health officer, or even Destiny as the health department administrator? The answer is that we are working together on this. So the cool thing is that we have already started those conversations with the county. We'll be county commissioners, and we will be meeting with them tomorrow also. So throughout all of this, I think we've had really great communication, because by no means do we want to try to do anything separately, because we're trying to do it as a county as a whole that benefits everybody. So it's a great question. the county commission acts as the board of health for the county. So there are checks and balances. As much as I would like to declare some sort of like maybe ice cream for everybody on Fridays or something because it's a health issue, I can't do that. I mean, I could if they'd support it, but I think they like ice cream. You know, we'll start a petition, but there is a way so that it's not just one person making all the decisions, and that would never be our intention, anyways.
No.
Okay, there was a question about, and please ask if there are more questions about like reopening and that kind of thing, because we will, for Wilson County, we are planning on still offering what we would want for guidance, or what we would, as a county, what we would have for guidance going forward for reopening, wouldn't you say? As far as like how we have throughout the whole thing, like we have all these, please continue to practice social distancing and blah, 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 blah. So that's what these discussions with the county commissioners are, because we want to line that all out, what's appropriate for our county.
Yeah.
That's right?
Yes.
Okay.
Yeah. We want to get it opened up in the most practical way for Wilson County,
Yes.
practical and safe.
So there was a question about are there ramifications for what people did over the Memorial Day weekend? I would say mostly it's hangovers. Like that's your problem. If I'm just kidding. But it is a punishment, more so when you get older. Man. But really, the reality is in Wilson County, and I can't speak for necessarily other counties. We are in the business of trying to educate people and trying to make sure that people are being safe. We are not in the business of trying to, like, citizens arrest people. I mean, we've tried that. It doesn't work. No one listens.
We're not scary enough.
No, we've been working out a lot, so it'll be scarier soon. But no, our goal is to not try to get people in trouble, but to keep people safe. And so, let's say, for example, the state or the KDHE made a is it a full recommendation, or is it like, what is it for the Lake of the Ozarks?
It was just they recommended, or they asked that people
quarantine if they were at the Lake of the Ozarks this weekend. You probably saw that there was a really good party that would have been great in non-pandemic times, but it was people smushed together. And even though we're outdoors, doesn't mean that you can just be
in a
caution to the
gigantic
wind.
crowd of people, and
yes, for especially prolonged periods of time. So are there ramifications? We hope that everyone stays healthy even after that, but there are
no legal ramifications.
Yeah.
The only time that there's going to be I guess you could call it a ramification, is if you go someplace that's on a quarantine list and you come back and you have to quarantine, which is another thing that I was going to mention from the governors. Is there anything else we need to ask?
No, go for that one.
Okay, so
we're so good at segues.
We are.
Speaking of that,
so the governor specifically said, and I will read it off so I don't get it wrong, the new orders will not restrict business or movement by the population. So I want to be really clear, because that's exactly what she said. The quarantine.
Did you say that's what she said? Okay, let's move on.
The quarantine orders coming from the state are coming from KDHE. They're going specific places because they are hotspots for the virus. So we're not saying you can't go there, or KDHE is not saying you can't go there, but we're saying if you go there and you come back, you need to be quarantined for 14 days. So that doesn't fall under the governor's purview. That is from KDHE, and those remain in effect.
Yeah.
Yeah.
That was beautiful.
Thanks.
That was so good. Nancy asked about long-term care facilities, and I believe we have a little spiel that we were going to talk about there.
Yeah, so we're not in charge of long-term care facilities. Long-term care facilities are working very closely with KDHE and KDADS, the Kansas Department of Aging and Disability, to make a good, safe opening plan for them. And that's basically all I know about it.
And you mentioned Morningstar, Nancy. I know they're present in both Fredonia and Yodashe. I will tell you, Destiny and I have been in contact with their leadership and administration throughout this entire thing. They've really worked hard, and also Yodashe Care and Rehab. I really am proud of what our long-term care facilities are doing, because they are fully aware, and as we all are, that this is hard on our family members that are stuck in a nursing home or an assisted living, and they don't get to see you guys. Like, some of them are accustomed to seeing people every single day, and then all of a sudden we're saying, sorry, you can't see them. It was done for a reason, to protect them, because they're our most vulnerable population. And I know that the staff there at our long-term care facilities have been working really hard to figure out, to watch the recommendations from these other entities, to figure out how to get visitors back in, but to also keep people safe. So hopefully as soon as they get the go-ahead, we'll be able to do that. So, you know.
Yeah, it's truly up to them. I mean, not up to them, but it's a priority
for them to try to figure that out. But just like our hospitals, we are not telling the hospitals when they can start doing surgery or whatever else. That's another entity. The dentist, I saw Dr. Newkirk on here saying, "Hey, you guys." I hope you liked that one, the Goonies. But yeah, like they are governed by their state entities, so they're able to make those decisions on their own. So, alrighty. When can we see our loved ones in Morningstar? Yeah, and Miranda, we get it, and we know that the mental health issues that are happening right now are probably at an all-time high. I mean, I hear about it, with my own personal patients that I talk to, and I know all of you do too. And it's hard on you guys who aren't able to see your family members, but rest assured, people know that and are working really hard on it to do it in a safe way. Okay, what else do we have? Other questions, you guys?
Yeah. I need to apologize for the park signs. I didn't get the park signs down.
Oh, gotcha.
But they're down now. Amy went and did that this afternoon. I apologize. I hope you played at the park this weekend.
And with the playground equipment, right?
That's what we're saying. Yeah.
Alrighty. Let's see what else. What other questions do we have, you guys? Oh, do you anticipate a quicker reopening? Mike, that is a good question.
That is a really good question.
I would say, so right now, darn it, Mike. Okay, so I would say right now in Wilson County, and again, that's what we're speaking for, but I think this is similar across the state, and so that's why we know there are people from other counties here. But right now in Wilson County, almost every business, every business that wants to be open can be open, with the exception of the swimming pool
and community centers. And
again, we've had good discussions with people who with people who are in charge of those, and like we've met with the rec boards and rec commissions, and just really had good discussions about that. We believe that reopening for Wilson County, the governor's announcement today isn't much different than the path we are already on. It doesn't change a whole lot because things are already open and we're already doing things. So I don't know if they'll reopen quicker, but we just have to like be careful. If it is a little sooner time frame, we just have to do it in a smart way.
Or it could be well, yeah, like Jen said, everything's open. The real I don't want to say barrier, but the mass gathering limit is the biggest limit. So I mean, it could be that goes up a little bit for us more quickly than it would, but everything's already open, so
yeah.
Okay.
Did you get that one from Carrie?
I did, and Chicago is on the.
Did you cover the states?
Did we? Didn't. No, I didn't say them. So Carrie's saying that Chicago area has had tons and tons, but Southern Illinois does not. So the states that are on the quarantine order are Connecticut, Illinois, Maryland, Massachusetts, Rhode Island, New Jersey, New York, anyone who's been on a cruise ship, including riverboat cruises, and any international travel. So I can't say, I don't know what their metrics are where they decide who's on it, but my guess would be it's easier to say if you've been to Illinois rather than if you've been to Chicago, because then it's like, well, the suburb of Chicago, and then for a while we had Colorado. It was only those 4 counties, which was a little more confusing because A lot of people don't know what county they're in. You know, they might know what town they're in, but they don't know what county. So I'm guessing it's just easier to do the whole state, but I don't know.
And Miranda's asking, where can you find the list for travel advisories?
They are on KDHE's website. If you go to KDHE, it's very easy to find.
Yeah.
Click on the COVID-19 banner, and on the very top, it'll say travel. I think it just says travel.
Yeah, I think it just
and then you
says
just
travel.
click on that, and it'll give you a list. It used to be this long document with a whole bunch of stuff. Well,
And
they've
now it's much
simplified
easier.
it. Yeah.
And they updated. I mean, you'll see when it was last updated also
Yeah.
on there. KDHEKS.gov is like the official KDHE website, I believe, right? KDHEKS.gov.
Yes.
Alrighty. Swimming pools was brought up, and let's see. Did you say that we as county can implement? Oh, okay.
Yeah.
So swimming pools are another topic here with questions, and you know there have been questions of like why not swimming pools, and you know like why are
Oh,
some
did
other
we
things?
answer that? I got the answer for that from last week.
Oh yeah, we did. I was, you know, we were gonna cover it. Yeah.
Okay,
So people were asking. Oh, but you can do it.
No, go.
No. We'll tag team it. We're very polite Siamese twins. So, anyways, there is actual reasoning behind it, and if I missed one, there were 3 reasons that they gave. I believe
3 main reasons.
3
I
main
think.
reasons. One was because you can't wear masks in a swimming pool. You could. You shouldn't. I mean,
CDC is not recommending it.
yes. Okay, don't do it. You shouldn't.
You could drown so much
Yeah,
easier,
like this
more,
stuff.
more easily, or
Maybe with a snorkel, but that's a whole. That's not the same type of mask. So, and then another one was about the first responders.
Yeah. So if someone were to have a heart attack in a casino, it would probably be a first responder giving them CPR, and it would probably not be mouth to mouth. At a pool, there's a much higher incidence of mouth to mouth CPR
By non-first responders.
by non-first responders.
And then there was one other one.
Showers.
Showers, yes, because like gyms and fitness centers aren't allowed to have their showers open, and we're I guess that is seen as kind of a high risk of transmission area. So if they couldn't be open for fitness centers and gyms, not for pools either. I will tell you for Wilson County, and you know there's a mention of chlorine. We do know that the chlorine will kill COVID-19, and so that's not the concern really. I know for in talking to the government officials in Fredonia, for example, having to open a pool under what originally was thought to be like a 30-person mass gathering limit was going to be more work, you know, than what we would be able to police. Like, do you make the 31st person stand outside? Like, what does that look like? So it really, so they've been very thoughtful about that, the rec commissions as well as the city governments in trying to figure out not only what's safe, but what's actually feasible, because it's still a business that needs to be run.
Yeah.
You know.
Yeah.
So great questions, you guys.
And Miranda, looks like Mr. Morrison put
The travel.
Put the travel link actually in the comments, so they're right there.
And Miranda Weatherby, you mentioned as a county, can we implement opening things differently than the state? And so the state officially doesn't have an opening plan anymore. It's guidance
as of midnight tonight.
So yes, we had mentioned earlier we're gonna have those discussions with the county commissioners, and we'll come up with those plans for tomorrow.
Yeah, but I will say, because I know that you mentioned Morningstar earlier, and then we mentioned that the state was working on a plan. I wouldn't necessarily feel comfortable opening up something like that without the go-ahead of the state, just because that's not my area and of expertise, is running a long-term care home. So,
right, yes.
So I want to be really clear there that
there's state guidance, but not from like the governor.
Yes.
Would say yes.
Yeah.
But state guidance from the different entities, KDHE, KDADS.
Yeah.
Those kind of things.
And yeah, I'm just gonna leave that.
Yes, Kansas Hospital Association, the Kansas Dental Association. Let's see. Don't inject or ingest chlorine. Okay, not an option. That is true.
Oh yeah, just swim in it.
All right. Oh, and Michelle from Morningstar. See, you guys, like our staff is so great. They're here and listening.
They're watching.
They said we are working on a plan currently. Like I said, they get it. They get it. What's going on? So thank you, Michelle. Awesome. Swimming pools, antibody testing. All righty. Good. Yes, don't inject anything. Let us inject you if anyone is to be injected. Don't inject each other. All right. how many cases here in town? Why are we still restricted? I guess I don't understand why things are still closed. So, and we kind of covered that, Kaylee, so you might want to go back on the video. You can watch this video 10 times, everybody. Yay, afterward. Please don't.
I do.
Yes, every night. That's how I fall asleep. Not really. But yeah, so one case in town that's recovered, and we're discussing the county reopening plans. So
yeah,
right.
and Diane, each county, she asked if each county will probably have different guidelines. It's a possibility. I know some counties are talking about sticking right with the governor's plan. And I know some other counties are talking about not doing that at all. So I think that's the beauty of this, is that we can tailor our own plan to ourselves. So yeah.
All right. So, but yeah, so counties, I think you'll see a variety of things happening. And I think a question before was like, when you're in that county, do you adhere to the county, like that county's guidelines? It's hard to know, right? Like what each county's reopening plans or rules or whatever are. Really, I think if you are going to another county, I mean, make sure you're social distancing, make sure you know what their mass gathering guidelines are. Don't get yourself into a tough situation where you might be exposed to things you don't need to be exposed to, and we can help you if you are traveling somewhere. We can help find out what those guidelines are. So we're here for you. I've pecked a couple people on here. I don't know what that means, but that's okay. How safe salons or masks can be. So salons is another question, that they are open. And again, I believe that our salons in our county are trying their best. We know that people can't necessarily wear like a mask with a strap around or whatever while they're getting their hair cut. Most masks, or lots of masks, go around the ears, so that's a little bit easier. You can hold the mask here, but we're really trying to keep people safe because there's such close contact in cutting hair.
Yeah, and as we were talking about reopening and all the struggles that people are having, many stylists are self-employed and not getting any sort of unemployment or any sort of assistance from the state, and I think it's great that they're open. I think all of them are really working hard to stay open. They don't want to take chances with themselves or with anyone else. So they're all trying very, very hard.
And we have recycled shirts on. I hope that's okay. But Destiny says a contact of a contact is not a contact. And then this one was given to us by Shelby that says,
virus fighting, curve flattening, mask wearing, people protecting, # Wilson County Health Squad.
There we go.
We have recycled t-shirts.
Do you advise that salons are safe, Dr. Jen? I would say that yes. I believe if they're taking the necessary precautions of making sure to clean between each visit, making sure that they're keeping track of everybody who is there, and usually they do anyways by appointments. And it's again, we aren't trying to like keep track of where everybody is. We really, we don't really care if you did get your hair cut or not. And I mean, unless you should get your hair cut, you probably do.
I should. Look at
I know
this.
mine's getting a little long. But yeah, I believe that they have the ability to be safe, and it takes the part of the stylist as well as the customer. And I think that's the biggest part of it. Mike, if you need a haircut, I'll cut your hair. Not really. I'm not good at that.
Is he the bald one? Which one's
No,
is that
that's Mark. Mark has no hair.
Sorry.
Oh, see, Miss Miller wore her mask when she got her hair cut. I like it. Good job. Thank you. All right. So we'll do a last call for questions if that sounds okay, and then we will let you on your way. We're going to do this in 2 weeks.
In 2 weeks. We're skipping a week.
We're taking a little breather, but pretty much you guys know how to get a hold of us. We're pretty sure.
We're pretty accessible.
Yes. And so if you have any questions, or if anything changes, like if there's another announcement, I don't know, we'll probably get back on here. But otherwise, we will plan on being back in a couple of weeks.
Yeah, and the commissioners are meeting tomorrow morning, and we're going to join in, and so hopefully we'll figure out what's going on then. The reopening plan has been on the county website. I would assume that will continue. And
Yeah.
so you can check the county website, and Cassie usually puts a link to it on the health department's Facebook page. So,
All right. So we do still, there's more and more evidence that wearing masks in public reduces the rate of transmission. They're talking like 75% reduced rate of transmission. So we do keep saying that. Some people feel as though they don't need to wear masks in public, but that's one of our best defenses we have right now, and we don't have a lot of defenses, and so that's why we push it. We base our information on the data we have, not just in Kansas, but around the world. And so if we can have that data, and that does show definite results, then that's the kind of thing that we will continue to suggest, is like wearing a mask in public, like at the grocery store, at the hardware store. If you're just outside, don't do it. If you're in your car, don't do it. If you have a private office and you're just in your office by yourself, don't wear a mask. But if you're anywhere where there are a lot of people, where you can't necessarily social distance, or you're going to be passing by a lot of people, then please do. There is not a whole lot we can do right now with COVID-19 besides preventing people from getting it, and that is proven across the board to be one of the best ways of prevention. All righty. Let's see. Oh, we'll miss you guys next week too. You guys are so nice. So 2 weeks from now, we'll put out another ridiculous picture of Destiny and I on some famous people's and probably unflattering people's bodies, and that's all right. It makes us feel better about ourselves. In the meantime, please, we talked a lot today about mental health and all of that. We hear people, we know people are hurting. Check on your neighbor. Text somebody, call somebody, make sure they're doing okay. Reach out to your healthcare professionals if you need more help than just a talk. I mean, we can do a lot. So if you have questions, please ask. We'd rather you be educated and know what to do, or we can help talk you through it, rather than people having to guess and not know. So be kind to each other. Please always take care of each other, and please stay safe. We're not in the clear. We won't be for a long time, but that doesn't mean we can't live our lives, but live our lives safely.
Diane wants to know if we're going to have to start bowing and curtsying. I think it's a fantastic idea.
Oh, I like it.
I do.
We'll wear more ruffles at the next one. Oh, yes. I don't know. It feels like a thing you have to wear ruffles when you curtsy.
Yeah,
I don't know.
at least a skirt.
My mom's not in here, but she used to dress me in those white gloves and hats and ruffles. It was... Anyways,
that was really cute.
Yeah, my therapist said that was a problem. Just kidding.
All right, guys. Thank you. And yeah, stay safe. We'll see you in 2 weeks.
On Tuesday at 5:30.
Yep.
Bye-bye.
Bye.